to support the suggestion that I am raising, that we have a meeting on Friday to approve all the outstanding minutes of the meetings that we have held. I really request that we do so. The minutes are already in our, I've started asking Ms. Machalamba to send the minutes to our emails. So the flooding of your emails with the minutes is to request you to read ahead of my request to approve these minutes this coming Friday. It may probably not be a long meeting, it's about 4 or 5 items. So if we do, maybe within an hour, might have really exhausted. But with that, honorable members, I welcome you and now request Ms. Machalamba to indicate the presence of members here, and then apologies if we do have. Thanks.
Good morning and thank you, Chair. Present is Dr. Lomo, Mr. Munyai, Ms. Gela, Mr. Sokacha, Dr. Jacobs, Ms. Seke, Dr. Harvard, Ms. Wilson, Ms. Ishmael, Dr. Tembe Kwayo, Ms. Chiro, Ms. Lengwa, Mr. Van Staden. That's all, Chair. I haven't received any apologies. Thank you.
Thank you very much. I do notice that in our platform, the MEC has logged in. Welcome you, ma'am. We would be getting a presentation from you with regards to the update on the COVID-19 together with you to vaccinate. We would be glad to hear where are you starting, where are you receiving your vaccines this afternoon? And then the platform is to you now to indicate who is joining you and the way you want to present. We did receive information that you wanted to change the presentation. I said, no, you will update us as you go along on which slide you want to say this information now is no more 32, but it's 37, rather than to rearrange and change everything. Members have been with this presentation for at least a day or two. So rather we ask you to indicate on a particular slide what changes, what figures are changing, rather than because the content I got, it is not changing completely, but you want to update us on some information. Thank you. We'll then allow you to introduce your team and then you start your presentation. Thanks.
Chairperson, just quickly, I raised my hand on the platform. I will be leaving a bit earlier, Chair, just to for me to raise an apology. Thank you.
Oh, okay, we accept it. Honorable Wilson, I see your mic is also on. You want to say something? Okay. Okay, Honorable Wilson, we can hardly hear you, but maybe you can then mute. Thank you very much. Thank you. Okay. MEC Sesikani, it's your chance now. Thank you. Start.
Thank you very much, Chairperson of the Portfolio Committee, and also honorable members. With me here, I'm with the HOD and the CFO, the Chief Director, and the advisor in the Office of the MEC. We want to take this opportunity, Honorable Chair, as a Department of Health in Mpumalanga, to thank the Portfolio Committee and appreciate the invitation to brief the Portfolio Committee of Health.
MEC, on this. MEC, can you maybe, even if you have a challenge, see your face? Yeah, see your face a bit. If you have a challenge with the connection, you can switch off later, but that's fine. I can continue.
Thank you very much. I see other members are closing the videos. I thought I can choose whether to open the video or not. Thank you very much.
When you speak, your video will be on unless you are experiencing a communication challenge in your space.
Thank you very much, Chairperson. As I was saying, we really appreciate the invitation to brief the Portfolio Committee for Health on the state of health and COVID-19 management. And of course, as far as the vaccine plan in the province. And I can confirm that we'll be receiving our vaccine today and we'll be launching tomorrow. But as you know, that MRC will be assisting us as a province, so we'll be working with them in the province. And indeed, we appreciate the ongoing support of the committee and the health fraternity in the country. The Department of Health in Mpumalanga and of course the countrywide have benefited from the work of the Portfolio Committee. And we were able to manage COVID-19 as led by the Premier and working with key stakeholders in the province, because we believe that working with stakeholders in terms of the behavioral change at the ward base assisted us a lot as far as managing COVID-19 is concerned. And also in terms of preparing for our facilities to make sure that our people find us ready as a Department of Health when they want us to assist them. So we can indicate that as a province, we are continuing to make sure that we kept the spread of the COVID-19. And also what we did is to launch a clinic-based model that assisted us a lot as far as managing the health system in the province. And we really appreciate that, of course, COVID-19 has shown that the public health system can provide quality services during the COVID-19, and working with our people, it really showed us that together we can work and be able to fight this pandemic. I will request Chairperson through you, the HOD, to present the presentation on behalf of the department. Chairperson?
Yes, yes, you can go ahead. The HOD can then move ahead and present. Thank you very much.
Thank you very much.
Good morning, Honorable Chairperson, Honorable Members, and Honorable MEC. As directed by the Chairperson, I will make the presentation that we sent last week to the Portfolio Committee. And as we are going through the presentation, then I will indicate where the updates. If we go to the first slide, this is showing base. Let me put it on to slideshow. The first slide is, and if you look at the status of health statistics in Mpumalanga, first if you look at the global statistics, on the 11th of February, just over 2.3 million deaths. In terms of the analysis in the country, was 1.4 million, with the total number of deaths of 47,382. In terms of Mpumalanga province on that date, you can see that the number of tests that we have done both in the public and the private sector, and at that point in time, we had 595 tests that were still pending by the NHLS. Our positivity rate had also decreased to 9.4%. The cumulative number of COVID cases in Mpumalanga, overall, we had 68,128 cases, which is also showing a drop in the number of new cases that we are receiving on a daily basis. The new cases, as I indicated, was 158, and the highest number of cases that were recorded was in Ishlanzeni district with 64. We have 18 sub-districts, and 11 sub-districts had recorded less than. And as I mentioned earlier, we have been receiving or seeing a decrease in our cases. So in summary, at that time, we had the total number of laboratory tests that we had done was 67,971, and this was the positive cases that we had. We have a recovery rate of 961, and unfortunately at that time we also had 1,133 deaths in the province. When we look at the cases per district, you can see that Elanzeni district, which is our largest district, had the highest number of cases at 41. Elanzeni district also had accounted for the majority of the active cases as well as the hospitalizations. Karsibande, however, was the one that had accounted for the majority of deaths in our province. Well, I won't go into detail on this slide. It just gives them per local municipality up and down. Also, in terms of the active cases, I've spoken to the fact that Mpumalanga was the city with 417, which is 24%, followed by Malashveli 210 and Sishwete at 196. Then in terms of the gender, it is always shown that females account for 55% of the cases in Mpumalanga. It has always been females accounting age category, followed by the 40 to 49 age group. The COVID cases by sector, in terms of our is accounting for 57% of the cases, and the public sector for 43% of the cases. Them down into the districts to give it for easier recognition. In terms of the districts per sector, you can see also in terms of the sub-districts, we have also broken it down to see the number of private and public cases. Also very closely, we can see that there's been a decrease in the number of cases during week 5 as compared to week 4. In week 5, we had 2,171 cases, and in week 4, we had 4,700. And we have seen that the new cases have been lower than the week before in all the sub-districts, in all the districts. When we also do the resurgence watch by districts, we've noticed that all our districts are under control, and as a province, then we are also under control. This is just showing as well the same thing. We also monitor our sub-districts to look at the resurgence, and you can see that all our sub-districts currently are also under control. And when you say under control, we mean that there's less than 10% increase, or there's been a decrease in the new COVID cases as compared to the previous 7 days. Also, we say that they are in alert if it is more than 10% increase and less than 20% increase in the new cases as compared to the preceding 7 days. And of course, the resurgence is if it is more than 20% increase as compared to the preceding 7 days. So currently, all our sub-districts is also just giving you the number of new cases so that we can be able to compare. We also look at the hospitalization on a daily basis by district and sub-district. And we get this information from the DATCOF. Some of our private institutions are still not reporting on the DATCOF, but we are in continuous engagement with them so that they get admissions in the province was 363. This also, you can see the number of hospitalizations are also decreasing on a week by week, which is showing that we are maybe going down towards the end of the second wave. In terms of the deaths, as mentioned, we had 1,152 deaths outside the hospital where the patients died at home. And from the 1,152, it was 104 that had died outside. In terms of the majority of deaths, most of our deaths are in the male, which is 58%, and especially in the 60 to 69. When we look to the comorbidities as well, 295 of the deaths, which is 26%, there was no comorbidities recorded. And when we look at the comorbidities, we find that most of our patients, 42% of the deaths, had hypertension. Positive was 9%. In terms of our isolation facilities, we have isolation facilities in all our districts where we've been isolating people. But currently, when we look at the number that is in the isolation sites, we have 14. But in total, we had 1,630, and the rest have been released. We are still having some challenges with the private institutions that are not reporting regularly. But in terms of our public institutions, we had a total of 2,464 cases that were infected. Currently, we have 754 active cases. Most have recovered. Unfortunately, we have 37 deaths in our healthcare workers. You can see, Honorable Chairperson and Honorable Members, there is also quite a few of our staff that are in quarantine or in isolation, which then leads to some of the challenges in our institutions in terms of staff. So in the private sector, we had 501 infected cases. Active currently was 18, and there were 3 deaths in the private sector. So in total, in the province, it's 2,965 healthcare workers that were infected with COVID-19. We've also broken down our healthcare workers into the different categories, and we can see that both in the public and in the private sector, it's the nurses that account for majority of the cases of COVID positivity. Also, we looked at the deaths that have been experienced now by our healthcare workers, and we can see that the deaths, it's also nurses again in the public sector that account for the majority of the deaths. We are still continuing with our screening and testing, and you can see that in total, when you look at the number of screenings that we have done at our, in terms of community screening, those that we're doing in our hospitals and our PHC facilities, we're also screening at roadblocks and at the border post. We've done 12,121, 691 screenings. In terms of availability of PPE, I know that this is quite a small slide and difficult to see sometimes, but in terms of the PPE, we wanted to be able to give the members comfort to say that we are okay in terms of our stock levels. If you look at the availability, we're at 93.1% in the province. And if you look at each of the PPE descriptions, we also have sufficient stock, and we are monitoring this on a daily basis. We are also sending this to the organized labor so that they can monitor it on a daily basis, and if they pick up problems as well, they then escalate it to the province. In terms of the availability of beds, the total number of standard beds that we have in the province is 8,263. In terms of critical care, we have 459. This is both in the public and the private sector. Beds that are dedicated for COVID, the private sector has not dedicated any specific beds, but said that all the beds will be available if there's a need. But in terms of the public sector, we had allocated 1,103 beds for COVID itself. And in terms of the critical beds, we had allocated 206. Currently, the admitted patients was in total was 186 for both for public and private, and in terms of the critical care, it was 64. So in terms of the bed capacity, the ones that we have allocated for COVID, they were still sufficient, or they are still sufficient. In terms of the summary for the oxygen supply and infrastructure, we have all our hospitals do have oxygen reticulation. 12 of our hospitals have the oxygen tanks, and 21 hospitals are using the gas bank, which has the oxygen cylinders. We are also monitoring the oxygen on a daily basis through the alarm systems that are connected to our nursing stations. All our facilities then order oxygen if it goes to 50% or below. What is driving the oxygen consumption at the moment is that if there's an increased number of patients and the types of respiratory support that our patients then require. In total, the province also has 3,547 oxygen points. In terms of our plan to manage the resurgence, currently we are also happy that none of our sub-districts or districts are in resurgence, and all are under control, as I explained earlier. Our plan to mitigate the second wave, we developed a plan that was based on the 9 strategic areas that the National Department had given as guidance, which was governance and leadership, medical supplies, port health and environmental health, epidemiology and response, facility readiness, information systems, risk communication and community engagement, occupational health and safety, as well as human resources. And the indicators when we use to monitor the resurgence, we'll also look at the new COVID cases, the testing rate, the percentage positivity rate, the active cases, our current COVID-19 hospital admissions, and then all the deaths that are related to COVID, as well as all other causes. So the overview of the response plan, we are tracking all the vigilance indicators, we identify and implement any interventions that are there, and then we continue our monitoring and evaluation. And then of course, we do provide the report and feedback. Some of the challenges that we are experiencing, especially in terms of the inadequate human resource, as I mentioned earlier as well, because many of them go into quarantine and isolation, we then have a further reduction in the numbers that we have available. But what we have done is that we have employed those unemployed professional nurses and nursing assistants to assist us as part of the roving teams for COVID. We appointed them in the first wave, and then when the first wave was over, we then distributed them to our facilities. When the second wave started, we then recalled them so that they can be able to go back to the community screening and the contact tracing. Also, we have healthcare workers from other programs that were drawn in to assist with the management of COVID, and the National Department is also busy currently analyzing the needs. We have submitted a critical list so that if it's possible, they will be able to assist us with appointment of further staff. In terms of the infrastructure, inadequate ICU beds and isolation wards, but we have adopted the model of decanting of the wards for the provision of services for COVID, and we've also identified and dedicated the beds, which include ICU beds for COVID. Our ICU and high care beds, we are using them together as critical care. An empty structure was also renovated in Woodbank Hospital into an ICU facility with the assistance of the South 32 mine. So that has increased our capacity as well. In terms of the inadequate transport to conduct contact tracing and community screening, we did rationalize the transport within the department and we prioritized the COVID-19 activities. Also, our department, as a department, we gave our officials approval to use their own cars and be able to claim back because there was a shortage of GG vehicles. We also borrowed cars from other sector departments because they were also not traveling during the lockdown. And the municipalities assisted us greatly as well with vehicles. We also managed to procure 33 vehicles and we're in the process of being registered. In terms of the non-compliance of the community members to the protocols, we do have the risk communication and community engagement strategy that has been developed and implemented. And there's community awareness campaigns that are conducted throughout the different electronic media platforms as well as community radio stations. And as our Honorable MEC mentioned, we have the clinic-based model to ensure that the communities also get the information at the ward-based level. In terms of our vaccination rollout plan, just a slight introduction that I'm sure all the members are also aware of is that the COVID-19 pandemic was a multi-sectoral impact on South Africa, which includes the socioeconomic impact and the health cost as well. The effective vaccination has been found to be one of the interventions to interrupt the COVID-19 transmission, and data does suggest that some of them are safe and effective. We know that the Ministerial Advisory Committee had developed a strategy to ensure that there's equitable access to the vaccines, and that, well, I won't go into much detail because when we said in Mpumalanga we were receiving 30,500 vaccines, this was when we were going to get the AstraZeneca vaccine. But currently with the new vaccine, the J&J vaccine, we know that because it is not registered in the country, it is being handled by the MRC, the Medical Research Council. The Medical Research Council has identified 2 institutions at in Mpumalanga for phase 1, which is Rob Ferreira Hospital and Woodbank Hospital. The reason that these 2 institutions were chosen by the MRC is because of the number of staff that we have in these hospitals and also those numbers that have tested positive. So in terms of the J&J vaccine, we will be getting 2,000 doses, which is 1,000 vials for Rob Ferreira, and 820 vials for Woodbank Hospital, which is 1,640 doses. The vaccine program was, as I mentioned, is going to be managed by MRC, and we have an Mzansi Research Center, which is part of the MRC at Middelburg Hospital, who will be supporting the province in terms of the vaccines. What we have done in terms of the governance, coordinating and planning for the vaccines, we have a provincial team that has been appointed for the coordination of the vaccines, and we've also established these at the district and sub-district level. The members are also representative of the key multi-stakeholders so that we have buy-in as well, and we have established the different work streams so that we can have smooth running of the program. The program will still continue to be rolled out into 3 phases. The phase 1 will cover the immunization of healthcare workers. As we know that we are only getting the 80,000 vaccine, or we've only received the 80,000 last night from of J&J, and hence the 2 hospitals have been chosen in the first part of phase 1 for immunization. In terms of the previous vaccine, but we still have these plans in place if the J&J gets approved, and we will continue with the vaccines in the same manner that we had planned for the AstraZeneca. We have done the identification of the target population, and we know that in our public facilities, in terms of our personnel, we have 30,341 healthcare workers. In the private hospitals, as well as we have partners that are assisting us as public as well, like Right to Care, Broadreach, etc. In total, we have 11,435. We also have private practice GPs and nurses, which account for 25,000, and of course the sector departments where you have nurses, for example, in COPTA, you have nurses in education, etc. They account for 2,480. So as a province, we are looking at 69,652 healthcare workers for the first phase. In terms of the identification, we will be sequencing them during the first phase as well. We should be starting with, well, our plan was to start with all the hospitals, but because of the J&J now, we will still be starting with the hospitals, but they're identified by the MRC and not necessarily by the province themselves. As we know, the phase 1A is going to be the healthcare workers that are conducting the aerosol generating procedures. That is those that will be doing intubation, ventilation, taking COVID-19 specimens, etc. And then phase 1B will be those that are in direct contact with the patients that are known or suspected to have COVID. Phase 1C will be those that are in contact with patients, not necessarily COVID positive patients or those that we don't know the diagnosis of COVID yet. And then phase 1D will be those that are not in contact with patients, like our admin staff, but they are support staff. In terms of where we're going to be doing it, our vaccines, we're going to be starting at the work-based vaccination program, which is the public and private hospitals. The private hospitals, I think, will be coming on board in the next phase, as indicated by the national department. And we believe that this is the best model and will be most suitable for our healthcare workers that are in the hospital setup. In terms of those workers that are in the PHC and CHC facilities, as well as private medical centers, we will also be looking at the outreach work-based vaccination program, where we'll be sending mobile teams that will move from facility to facilities, because in some of our clinics and CHCs, there are very few healthcare workers that are allocated. So it would be easier for us to be sending the teams rather than sending the vaccines to their to be inoculated there. We will also be having the vaccination centers that may be remote or facility-based when we start with the public as well. These are on slide 55 is what I've already explained when I was doing the previous slide. I've also indicated the service delivery platform for the work-based vaccination program, which will be our hospitals. In terms of vaccine distribution and the vaccine sites, the push strategy that has been starting from the National Department of Health that will be employed. In the province, the initial plan was to have all the vaccines delivered to the medical depot, and then we will deliver them to the respective hospitals. But with the Johnson & Johnson vaccine that is now not registered, it will go straight to MRC. Then they will distribute to the two hospitals as needed. In terms of the cold chain and the logistics and infrastructure, it is vital that we have the good storage and safe handling. We do have these in our institutions. We've done an audit of the distribution in the vaccine facilities, and like I mentioned, it will be delivered at the depot if there's approval. We have 31 hospitals that have the approved fridges and the backup generators. The other two hospitals are very small and they function more like CHCs. Hence, we did not include them in this part. They will be part of the, they will fall under the other hospitals, and the staff will be then covered in those hospitals. We are also in the process of procuring the continuous temperature monitors. In terms of the timeline for the intervention, it was supposed to be that the vaccination was supposed to be in the 3 districts in less than 1 week. And then our hospitals, for our own staff, we have the 2 weeks, and all our outreach services, we're supposed to vaccinate the PHC facilities also with 2 weeks. However, Honorable Chairperson, this may change now depending on how we get the vaccines and how they are allocated equitably by the National Department or MRC. As I mentioned earlier, it will start at the hospital level. We've identified also all the 31 hospitals that will receive the vaccine. I mentioned that Waterfall Boven and HX are very small hospitals, so they will join the nearest hospitals. We also estimate that one vaccinator will be able to vaccinate 50 people in 1 day. So we can see that for most of the hospitals, we'll be able to complete them within 7 days maximum. The province will also be given an allowance of 10 days to be able to capture those that may be on sick leave or who are day off, etc. All the hospitals will also, we're supposed to start on the 15th of Feb, but because of the new plans, we will now start tomorrow to implement the plans. In terms of our work-based vaccination sites, I've just given some details here, Honorable Chairperson, in terms of each of the hospitals where we identified the number of staff members, the number of vaccinators. Also, we had known how many vials will be allocated to each one, and then the expected date to finalize the vaccine if everything went according to plan. The process flow is, as I'm sure for all other provinces where they screen for eligibility, we look at the health education registration, pre-vaccine administration, vaccination, as well as observation and appointments. In terms of the outreach teams that we're going to go out, we have identified that we'll use our mobile clinics. We'll also use our outreach team leaders in the school health teams that will be moving from facility to facility for our CHCs, our clinics, our EMS, and some of the private stations as well. In terms of phase 2 and 3, we have started looking at some of the planning already. An estimated total of 3,157,000 will be vaccinated during this phase. It excludes those that are under 18 and the people that will be vaccinating in the first phase. The phase 2 will include the essential workers and those that are in congregate settings, as well as those above 60 years and those that are over 18 but with comorbidities. And phase 3, of course, is going to be all those that are, sorry, not below, above the age of 18. The service delivery platform will be our health facilities. It will be our vaccination centers, the outreach vaccination program, as well as work-based vaccination program. And we think that this would be best, the work-based vaccination program for the mining sectors, the industries, the big industries, as well as other departments where we can get them to be accredited as well as vaccination sites. In terms of the remote facility and outreach vaccination centers, it will also include all the essential workers and the general population, which I mentioned will be at the workplace through the wellness clinics. The other sector departments, we are also hoping that they will be vaccinated by the health professionals in their workplace, which will be able to then coordinate and support. And the service delivery platform will also include where we'll be able to use maybe community halls in our municipal wards so that we can be able to be closer to the people rather than them having to travel to health facilities where it will be overcrowded as well. In terms of the safety and security, well, for now, it will be where MRC will be responsible for that safety because it will be delivered to their facilities, and then they will be allocating to the hospitals on a daily basis as to the numbers that will be needed per day. But we have also made plans in terms of the province to make sure that the vaccines have been distributed. There was a twofold plan that is in place, and it will kick in the minute the vaccine is then registered and we can go back to the way we were supposed to be implementing it. The first goal was to ensure that the vaccines were given to the right person at the right time, and we know that this will be assisted by the registration of all the healthcare workers and people through the EDVS system. We'll also be calling the people per appointment and the ID barcode that will be scanned to ensure that the vaccine is given to the right person. The South African Police Services have also been brought on board, who will ensure that there's safety of all the vehicles that are transporting the vaccine that was supposed to be from the medical depot to our various vaccination sites. And our vehicles that will be transporting the vaccine will have a tracking device. And we will stop all unnecessary stops that will be avoided during the transit period. In terms of the adverse events as well, we will have an adverse events following the immunization that will be integrated into the existing patient safety incidents committees at all our levels. And the Covishield vaccine, which was supposed to have been administered, would also to be able to report during the vaccination period within 24 hours. In terms of data management, the electronic vaccine data system will be used to register all the target population. National Department did inform us that it will also include the migrants, and the data quality will then be conducted on a regular basis, and there'll be weekly and monthly reports that will be generated through the same system. In terms of communication and demand, we have developed our communication strategy to address myths and vaccine hesitancy, to improve the acceptance and uptake, and to approach community leaders to be able to influence and mobilize our communities for the vaccines and to be able to create awareness using the different media platform. However, there has been some lull because of the change in the plan and in the vaccine, but we have started with our communication, especially with the organized labor and with the staff, so that they can be buy-in first to be able to administer this vaccine, because all of them will have to give consent before we give them the vaccine. So, honorable members, our recommendation is that the members of our portfolio committee take note of the status of healthcare services in Mpumalanga, plus our vaccination rollout plan, and provide guidance so that we can be able to improve on the plan. Thank you, Honorable Chairperson and Honorable members.
Okay. HOD, thanks for the good presentation. Can the members see your face? I know your face.
I'm going to, okay, I'm just trying to open it here.
Yes. Okay.
Thank you, Honorable Chair.
This is the HOD of Mpumalanga. Thank you very much, ma'am. Okay. Honorable members, this is the presentation by HOD and MEC that you would like to interact with. Please follow one after the other. I'm just checking here because Honorable Wilson, Honorable Wilson, because you are traveling and from where you are now, you can still hear us. Can I ask you to jump the queue and you are the first one to ask so that we don't lose you? And then the order will then follow this way. Honorable Wilson will now jump the queue and be number 1. Number 2, Honorable Van Staden. Number 3, Honorable Ismail. Number 4, Honorable Sokacha. Number 5, Honorable Dr. Tebeguaro. Number 6, Honorable Ella. Number 7, Honorable Chirwa. And I've rearranged the order to accommodate Honorable Wilson. You can then start. I can see you parking on the roadside now. Go, ma'am.
Honorable Chair.
Thank you,
Honorable
Chairperson. Chairperson, there's somebody who needs to speak.
Yes, it's me, Honorable Wilson. Honorable Chair. Yeah.
We are not Honorable Wilson. I don't know.
Yes, Honorable Chair. I'm not Honorable Wilson. Can you check the chat group also? I've got a problem with my cell phone, so I've posted the message on the chat group. Second.
Okay, I'll check. Honorable Wilson, continue now. I'll check the group message. Thank you.
Thank you very much, Chairperson, and thank you for considering my situation. I appreciate that. I'm going to keep it very brief because I'm not sure for how much longer I will have signal. 2 main questions, because a lot of my questions I know will be asked by the Honourable Ishmael. 2 concerns. If the MEC just will give me clarity very briefly on the comparisons. I think I missed this in the presentation between home deaths and hospital deaths on the COVID-19 situation. It was on her presentation, but I was battling to follow it on the road. Secondly, Chair, an update on the situation with regards to the waste disposal of the COVID vaccine vials. We have raised this with all the other provinces as well. There are a lot of concerns with regard how these vials will be disposed of, and if special plans have been made to dispose of the COVID vials, because we had many instances, and this was out of China, where people stole the vials, the vaccine vials, filled them with saline water and were selling them off to people who were desperate to get a vaccine and giving them a vaccine that actually wasn't a vaccine at all. It was a saline solution. So I would really like some clarity on that situation. And at the moment, Chair, I will leave it there. I know that my colleague has a lot of my questions as well, so I will ask the Honourable Ishmael to continue on behalf of us. Thank you.
Okay. Thank you. Drive safely, Honourable Wilson. Honourable Secretary, I don't see your messages on the group. And can you resend?
Sorry, Chair. Honourable Wilson.
Yes, ma'am.
I'm so sorry, Chair. You did say that I could raise a concern about the minutes. And as I'm first and I have pulled over, I'm going to start again. So I have a very, very big concern with regards to the minutes. I hear that we have to have them signed off by the end of this week. But it's very difficult, if not impossible, Chair, to get all these sets of minutes. And now we must try and remember what happened in April last year in a meeting. It's unacceptable, Chair, and this is one of the situations that we wanted to raise when we had our private PC meeting, the one that we asked the Chair of Chairs to attend. I've read through those minutes, Chair, and it's very, very difficult for us to try and ascertain or remember what actually happened in a portfolio committee a year ago, particularly in light of what's happened in the last year. Thank you, Chair.
Okay, we'll try and engage with the House Chair with that matter, but we'll hear what other members are saying, because it is like now coming in. The COVID came on us and we were not aware we will delay in getting the minutes finalized. Honorable Secretary, I still maybe say what you want to say. I don't see your information here.
Chair, my apology for inconvenience. I've not sent my message in the WhatsApp group. I did send in the meeting chat group. Check your laptop.
Oh.
Chat is in the meeting chat.
Okay.
I think I was the first person to raise write the message actually, followed by Staden.
Or that you wanted to speak. Hello.
Can you see the message?
I normally read on the WhatsApp group. I hardly see that. I'm scrolling over. If you had written there, you want to speak, then let me give you first. I normally look at my SMS on my WhatsApp and also on the raising hand in the platform. I hardly go to read those messages, but I can go there now. If you want to speak, let me give you an opportunity before Honorable Van Staden. Okay.
Oh, thanks, Chairperson, and let me apologize. And I've got a problem today with my cell phone, Chair. Hence, I've sent a message in the chat group of our meeting. Chair, with regard to, let me appreciate actually the presentation by the Department of Health, led by the MEC Sasekane Manzini in Mpumalanga. Chair, I'm appreciating this because the MEC and the team has been hard at work in making sure that we fight this pandemic in the province. I also appreciated the clinic-based model that have been launched by the MEC because it comprises of all the stakeholders in different wards, and I think those forums in a clinic can be able to spread the information and make sure that all the protocols, COVID-19 protocols, are implemented, Chairperson. So I just want to appreciate that. And even if when you look at the death cases around Mpumalanga, Chair, I think they're manageable, Chairperson. So I want to appreciate, and even the work that has been done by the health workers in the province, Chair. One, MC and the HOD, when you look at the statistics, it has the lowest cases. Kharsibande has the lowest cases as compared to other regions in the province. But when you look at the death rate cases, it's a bit higher at around 448. And just to check what can be the reasons for that. And then on the other hand, when you look or when you analyze the death rate in the province per sub-district, your Emalahleni, your city of Mbombela, your Steve Trade, do have the high rate of death cases. And I think it should be our responsibility, and including myself too, because I'm a resident there and I'm a leader in Mpumalanga, that I think we strengthen our educational campaigns, and also we reinforce the work of the clinic-based model in those identified sub-districts. Emalahleni is pretty high. I think it's scary in Emalahleni, Chairperson. And my other question is on the department has reported in slide, I think it's slide 39, if I'm correct, that there are 33 hospitals in the province, and only 31 hospitals are identified in the vaccination rollout plan as work-based vaccination site. I think it's in slide 45. Can you explain this discrepancy, HOD? Noting that there was a reason that was noted that the waterfowl bovine vaccine will be delivered in what is this? NA Grove Hospital. And then my other question, Chair, with regard to preventing corruption in the vaccine tenders, what special measures is the province implementing so that we can be able to keep the corruption in the vaccine rollout? Chair, the other question, Chair, Mpumalanga it's surrounded by mines, a lot of mines, Chair. And I'm not quite sure what kind of assistance are we getting as the province or as the department in terms of mines that are surrounded or that are in Mpumalanga. Chair, I've noted that there's only one that has been identified in your presentation, which is South 32 mine, which has been able to assist, and we appreciate that. So what kind of assistance are mines given to our province, Chair? And then how will the private health hospitals be included in your first phase? Because if you look at the presentation, only public hospitals are listed. Chairperson, I think it's identified in slides 45. Or are they going to roll out the program separately other than this? And then on the other side, my other question, there is a slide that speaks to the shortage of transport, if I'm correct, Chair. Just a question to the HOD, if as the province, do you have sufficient ambulances in the province to deal with the surge in COVID-19 cases? I think my last part one question, do we have any Cuban doctors in the province as part of the intervention by national department? And then my last question, Chair, is what is the status of community healthcare workers in the province? I know there have been challenges sometimes back, just to check if they are insourced and permanently employed in the Department of Health. Thanks, Chairperson.
Right. Yeah. No, I was just saying, honorable members, please assist me. I normally look into the chat group on WhatsApp and also on this platform under participant, a sign of a hand raised. I don't go on another third platform. If members were to just use those two, but in the event you use another third platform, please indicate, because I may end up not chairing a meeting and checking all these three platforms. I usually use those two to check and even indicate there. To use the chat group, just to give me a or indicate before I start putting your names down. The name that is coming in now, Honorable Van Staden. Honorable Munya, you are number 8 because I did not see your name also on the chat group, unless you are also experiencing challenges there. So Honorable Van Staden will be followed by Honorable Ismail, Honorable Sokacha, Honorable Totatembekwayo, Honorable Kela, Honorable Chirwa, Honorable Munyai. I haven't heard anything from Mamu Sheng, and I know she's in the platform. After Munyai, Honorable, who's last? Have I left anyone out? Yeah, the number 8 is Honorable Munyai. Thanks. In that order, honorable members.
Thank you, Chairperson. I hope that you can hear me. My signal is a bit vague this morning. I just have 8 questions. On phase 1 of the vaccine in Mpumalanga, you intend to vaccinate 69,000 healthcare workers. Surely you will have to set new timelines regarding the problems that occurred with the vaccines. I just want to know, when will the new timelines be available and by what date will all the new phases be complete in your province, and how many of the 80,000 Johnson & Johnson vaccines will Mpumalanga receive at this stage? And then a second question, I see that the departmental transport looks like a big problem in this province. I just want to know what is the status in the procurement of vehicles for your department. for extra vehicles and new vehicles. Can we get, no, sorry, let me go to the other question. You have spoken about screening at roadblocks. I just want to know, because I have received a complaint via telephone, but there's no social distance and etc. at these roadblocks. I just want to know, how are you as a department overseeing this project, or do you let the South African Police Services handle it completely on their own? I just want to know, what is the status on your field hospitals and quarantine facilities? What is the status of new interns for 2021 in your province? What is the status of PPEs per hospital and clinic in your province? And do you have any backlogs on laboratory testing? And if so, what is the latest number? And with how many days or weeks? That's all for me. Thank you, Chairperson.
Okay, let's follow one after the other. Honorable Ismail.
Thank you, Chair. Good morning, and thank you for the presentation. Firstly, how much PPE tender corruption was uncovered by the SIU in the province? Have any officials been charged or held accountable? Secondly, there have been allegations of vaccine tender corruption. Has the department investigated any claims around vaccine tender irregularities thus far? And what preventative measures has the province put in place to ensure that there is no possibility of corruption going forward? My third question, how many vaccines will be given to the private hospitals, and will they have their own vaccine rollout program? Because I see the presentation doesn't cover private hospitals. I understand that, you know, you're focusing on public hospitals right now due to the amount of vaccines you're getting, but if we could get some sort of, you know, notification and update on this. I see my colleague has touched on this, but I will just mention it anyway. The presentation doesn't speak much on EMS services. Please, can you provide a report on your ambulance services and how they're coping with a spike due to COVID and, you know, attending to normal services? Please provide a report on quarantine sites in the province. I think Honorable Van Straten has mentioned that. Please advise how many and where intern doctors have been placed in each public health facility in the province. Also, please advise if these intern doctors have been paid their normal salary and for any hours overtime that they work. This is becoming a major problem throughout the country. Has the department considered appointing community service doctors that have finished their com service term? If yes, how many have been appointed, and if not, why not? The issue of Cuban doctors and their placements have already been asked. How many people in the province need to be vaccinated to ultimately achieve herd immunity? I think this will be easier for the department to be able to, you know, lay out plans for the future once more vaccines are procured. For the second phase, how many people are estimated to be insured and how many are uninsured? You know, looking at page 20, considering the amount of healthcare workers' infection rates and COVID deaths in public facilities are far more than in the private sector. I mean, has the department, you know, thought of this? I mean, could this be attributed to shortage of proper PPEs in the first phase of, you know, when COVID started? And lastly, please, can the department provide a report on how mortuaries have coped in the province? Thank you, Chair.
Honorable members, you know now who comes after Honorable Ismail. It's Honorable Sokacha.
Sokacha. Thank you very much. Thank you very much, Honorable Chairperson. Let me also take this opportunity and thank the MEC Manzini, and the HOD for the presentation. Chair, let me shoot and go straight to my questions. The first question is around the communication strategy. I've heard the MEC explaining it, and even the HOD giving us detailed on how they are doing in terms of their communication strategy. I just want the HOD on the MEC just to deliberate more, because I'm interested in how are they doing in terms of making sure the information is getting through their more flank areas or their rural areas in Mpumalanga, making sure that our people are getting the information, more particularly in terms of the vaccination, because there are still some fears. Other people are saying they're not going to take it, they are afraid of it, and others are saying they're going to take it. Just interested, how are they doing in terms of their far flung areas? The second one, Chair, is around, I've seen the HOD have mentioned the isolation facilities that they are having in Mpumalanga. They've given us the numbers, the details. I'm just interested, Chair, these isolation facilities, are they increasing or are they getting lesser? In other words, the number that they started with, are they still having those numbers of the isolation facilities or are they getting lesser and lesser? Then the third question, the HOD have touched it, the issue of the oxygen. CS are assured us that they don't have shortages of oxygen in Mpumalanga, which I'm very happy to hear that. Around the inadequate human resource, the HOD have briefed us and she has indicated the shortages and so on. I want her to deliberate more. What are they doing as a department in making sure that they are addressing the issue of the shortages of staff? Then, Chair, I'm also interested in how many staff has been trained in terms of the distribution of the vaccination. Are there any staff that they've trained and how many are there? Around the healthcare workers, Chair, in fact, the MEC have indicated that they are getting the vaccination today and so on. I'm just interested the number of vaccination that they are going to receive vis-a-vis the staff, the healthcare workers that they are having. Are they correlating? Are they not going to get in shortage, or are they having adequate vaccination in terms of addressing the number of healthcare workers that they are having in the province? The last one, Chair, any donations that the department have received in terms of addressing the COVID-19 campaign. Thank you very much, Chair.
Honorable Sokata, I must congratulate your IT person today. Whoever did that job, please don't lose that person again.
No, I was just embarrassed by other people, Chair. I said, let me just tune myself up because everybody was on the screen. And I said, let me just tune myself up. Thank you very much, Chair.
Thank you, Chairperson. My first question is based on the announcement that was made to say the 2 hospitals that will receive the vials, specifically on the Wheatbank Hospital. And I just would like to ask, because Wheatbank Hospital on social media has been portrayed as a very, a very dirty hospital from the entrance until wherever you can get to. Just to ask the MEC to say, are you doing something in connection with, getting the hospital to be clean, humanly clean? Because during the COVID-19 situation, we are supposed to wash hands and be able to keep ourselves clean at all time. But the situation there from the chosen hospital needs to be attended to. And to ask whether you have addressed the shortage of staff and specifically also the shortage of beds in that hospital, since it's also being identified there. I just want to have clarity on how many healthcare workers have registered today successfully on the EVDS, the online application to receive the vaccine, so that we can be able to argue on the number that has registered successfully with the contradictions that we have on the phase 1 that will cover 69,652 and the 30,500 anticipated vaccines from the failed AstraZeneca by then, because we need to know in actual fact to say your planning of the vaccination rollout is not in actual fact very clear, irrespective of the fact that you have chosen some hospitals and that to can do that. And secondly, recently in the province, you have had a problem of rain. And then I would like to know whether are there any health facilities that have been affected by this, and how is this affecting service delivery in your province, specifically towards the vaccine rollout plan? Do you have any trials run in your province to test the efficacy of the vaccines? And how many Cuban doctors are deployed in your province? And how are they utilized? And then the last one is, how are the traditional healers incorporated in the rollout plan? But to engage you on the problem that I received from some of the concerned people from Mpumalanga, to say in some hospitals in Mpumalanga, the health workers who were tested COVID-19 positive were given 22,000 rand after being tested positive. I asked the National Department of Health about this, and then they said they don't know anything about it. So I should refer the question to you. Thank you.
Honorable members, before I call Honorable Gela, just to mention that Honorable Kwakube has joined us. She wants to apologize for not informing us before the meeting starts that she will be delayed, but she has now been part of us. Thank you very much. Honorable Gela.
Thank you very much, Chairperson. Let me also welcome the presentation done by the HOD, but also welcome the MEC of Mpumalanga. And also we are happy that today you are receiving the vaccine as a province. Sitimali Bongwe. Chairperson, most of the questions have been asked by members, but we are really happy that the Mpumalanga so far is doing very well with the work, and also they are hands-on in terms of making sure that people get information and are aware about what is happening in terms of this COVID-19 pandemic. My question, Chairperson, I'm going to talk about the traditional healers, MEC. I know that it's a very important stakeholders in our country, and if we left out them, it's a trouble actually. And we must make sure that we also involve them so that at least as we know that they are also playing a very important role to our stakeholders to make sure that they also do their work, and also making sure that they also assist us, as we know that they are not medical professionals, but they are traditional practitioners in the country. My question, Chairperson, I want to know from the province that how are the traditional practitioners incorporated in the rollout plan? That will be my first question. The other question has been raised, but I think we must emphasize, because it's something that really it's been raised in many provinces, the issue of healthcare workers being exhausted, working day and night. We know that saving the lives of people of South Africa throughout, and we just want to know actually as the province what support that you are giving them, because really they are so they are working under stress. And also the other issue is being asked by members in terms of the healthcare workers. The other issue, Chairperson, is that at the hospital, provision is made for 10 days to vaccinate staff who are off sick or on leave. But we just want to know what will happen actually, or it will be done the same way with the smaller facilities such as clinics in the province, because I think they also play a very important role that we must also make sure that they also get the vaccines. The other issue, MEC, that I want to check with your province, it's been an issue that has been raised by 6 provinces that we have already managed to see them or to have a meeting with them. It's the issue of the oxygen challenge. I know that you have presented in your report, and we really appreciate it, but we want to make sure and check because we heard that the Afrox is having challenge in terms of oxygen, and some provinces have raised a concern with higher demand for oxygen. But I just want to check, how is the department ensuring that there are adequate supplies of oxygen in the province of Mpumalanga? And the other issue that I wanted to raise is the issue of the rains, as we have seen, but Honorable Tembekwayo, Dr. Tembekwayo has already raised that question. Then the last one that I want to raise is the issue of the last one, Chairperson, it's an issue, or what is the role does the vaccine coordination committee play in terms of the whole process? And also, I hope you didn't left out the one important stakeholders and the relationship between the department and also the labor, because if we left them out, it's going to be a problem. Those are my questions, Chairperson. Some of the questions have been raised of the brigades, Cuban doctors, and other issues, but we really appreciate the good work that you are doing as a province. We know that it's a vast province. It's having rural areas, far rural areas, but so far we are really happy as the portfolio committee in terms of making sure that you act and also you respond immediately with the challenges that you have faced. And I'm happy because we have also addressed the issue of miscommunication by the media. We heard that there were also rumors that were all over on the social media in terms of tenders, but we have managed to respond adequately and also on time to make sure that at least we are on part and also responding accordingly. But so far, MEC, we really appreciate the good work we are seeing forward in Bogoto with the good work that you are doing. We know that you are working under pressure because of this pandemic, but we are together to make sure that one day we'll overcome this COVID-19 pandemic that is facing our country. Thank you very much, Chair.
Honorable Chirwa would be followed by Honorable Munyai.
Thank you very much, Chairperson. I think there's a persisting grievance on my side in relation to the presentations that are being done by the provinces. And firstly, it is, or primarily, it is that I pick up a lack of being proactive by the provincial departments of health, and it is no different. It is no different in relation to Mpumalanga as well. But I'll align my questions nonetheless. During our NHI public hearings in 2019, it was raised one too many times that the EMS is in a serious catastrophe is a serious challenge in the province, especially in rural areas and township areas. Can the MEC please explain the distribution of EMS vehicles in the province in detail, and how this was amped up in preparation for the second wave, and how it is currently being amped up in preparation of the third wave and the fourth wave? It is a serious issue and concern because it still persists. We see on a daily basis, and we get daily grievances on people waiting for ambulances that end up not showing up. And the entire portfolio committee is precisely aware of this particular issue because it was raised one too many times by almost each and every presenter at the NHI public hearings in 2019. It is 2021 now. Can we have a precise update on what was done by the province in the very least in relation to EMS? And secondly, how many vaccination sites are currently ready to facilitate the vaccination process? Because it is something that I picked up even with the National Department of Health, that even though there are sites that are named and all of that, we know where these sites are, the readiness is not necessarily a reality. And we also picked this up even at a hospital we were doing oversight at last time in Edenvale Hospital. So I want to precisely know how many of the vaccination sites in the province are ready and where these vaccination sites are in particular, so that we can also go and do oversight to ensure that the readiness is not just on paper, but is a reality. As was with the National Department of Health, their readiness was just on paper. But when you go there to check these vaccination sites, not even a single table has been outlined, not even a single fridge has been delivered. And yet they are reporting to this portfolio committee that vaccination sites are ready. So can the province also tell us and give us names of which of these vaccination sites are ready, so that our public representatives can also go and visit and check if it is indeed the case and there is no adopted tendency from the National Department of Health by these provincial departments to lie in these portfolio committees and declare readiness of vaccination sites and other things, when we know that in reality on the ground it is not the case. And thirdly, the issue of security, MEC, cannot just be left to the MRC in relation to vaccination. And the province, in what you have given us so far, is failing to outline how precisely the ensuring of security, not just of the goods, but the security of the hospitals and the vaccination sites in general will be facilitated even post this pandemic or even post the vaccination process. Because if the MRC had to intervene, then we already pick up that security is an issue in the province and it is not being prioritized so much that the MRC had to intervene on your behalf in your province. The issue of security in Mpumalanga is much more bigger than the issue of vaccination. Just not long ago, a 12-year-old boy raped a 5-year-old at a hospital in Mpumalanga last year in November. The province was also said to be investigating this particular issue. So what I'm highlighting here is that the issue of security, we must not lie to one another or misleading one another. In Mpumalanga, it is an issue. Even not so many years ago, a doctor was murdered by a patient in a hospital. And healthcare workers raise the issue of security on a daily basis. How does the province respond to this? The South African, the SAMA, had recommended swanning too many times for the inclusion of the biometric system to ensure that healthcare workers, medication, and the hospitals in general are safe, or that there's at least a tracking of people that are entering hospitals. How has that recommendation been adopted by the province, even though it hasn't been adopted because there's not even a single clinic that uses a biometric system to care for the medication in the very least? But what are the attempts to strengthen the security system in the province? Because it places the lives of healthcare workers in danger, the lives of patients in danger, the security of even the medication, because we also know the issue of medication in local clinics going missing. So I think there must be much more attempts to report on the issue of security in Mpumalanga than to just give us and tell us that the MRC is going to be responsible for it. There is a failure. It's an admission of failure that the MRC had to intervene because obviously there's no security system that's reliable in the province. How do you plan on resolving the issue of the fact that your security system in the province is unreliable? It's non-existent. Doctors and patients get raped and killed in your hospitals. And number 5, How many community healthcare workers does the province have currently? How many were added on in the past year? When will they all be permanently absorbed by the province? This is a question that I would really like the MEC to answer in detail, because we are seeing also a catastrophic event, a turn of events in the Eastern Cape, where 650 workers were released and then taken back in, and then now today we learn that 1,000 have been released again and their contracts not renewed. Can we also have a breakdown on how many healthcare workers, community healthcare workers we have in the province, how many are going to be absorbed, how many were added on in the past year, and so on and so forth. There was an individual at the NHI hearing in Mpumalanga, I forgot which district to be precise, and there was an individual that raised an issue of them not having access to getting a new wheelchair. This is a very peculiar case. I want the MEC to update us on this particular case, because she had made a commitment on that day in front of all of us that they will ensure that this particular individual gets a wheelchair. This was in 2019. It's 2021 now. In front of everybody here, please, MEC, let us know what is the update on that particular issue. And I'm raising this very intentionally. And there's also an issue of the long drop system in Mpumalanga. And yet we're not picking up if there's an attempt to create a relationship between the Department of Water and Sanitation and the Provincial Department of Health in Mpumalanga, regardless of the fact that these issues are interlinked. That is what I mean by the fact that the province is not proactive. You always want to wait to be given a criteria that you can't think for yourselves. In our particular province, the context is that we're not like Gauteng. We have an issue of long drop systems in our schools, in our rural areas, even in public in public facilities. There's an issue of long drop systems. What has the province done to counter this? Because we also know it contributes. Sanitation, it contributes to the issue of health in Mpumalanga. And also they raised last year, in particular in relation to Mpumalanga, the issue of food parcel corruption was too many times. Food parcel corruption by local ward councillors. I want to know what has been done by the province in response to this kind of culture that has been gracefully not attacked and confronted by the province, especially during a very tough time globally. What has the province done to not only confront and counter the situation, but to ensure that the compromised families, the compromised individuals, the compromised people in this particular debacle were supported by the Department of Health? We must not stray away from the fact that the Women's Charter, for example, the Bill of Rights, our Constitution, makes a proper relation to nutrition and health. And thus we must always find a way to ensure that this particular link is not erased because the provincial departments and the NTOH is unable to deliver on it. It is one of your primary obligations and mandates. I want to understand what was done by the province to ensure that this particular thieving by local ward councillors of the ANC stops, and that the individuals that were compromised by this particular situation, who didn't get food parcels, who were compromised with their immune systems compromised and all of that, what has the department done to respond to that? Thank you very much, Chairperson.
Honorable Munya, you are the last hand.
I must say, first and foremost, Honorable Chair, I must admit to your proposal that we need to have to look at that minutes on Friday, really to comply with everything. I mean, we would, even if it would have been long time, we don't forget our appropriate resolutions, because really the staff that prepares that minutes, they would have gone through the records. I propose the proposal for Friday really to be in compliance to approve all the minutes. This is good governance, we'll do that. Thank you very much. I support that first proposal. The second interesting thing, the Mpumalanga presentation really reflect the wonderful preparedness on the side of the MEC and the entire team. So the other critical issues, I think Honorable Sokacha touched on this. Availability of oxygen, which seems to be the major problems across the country. But in Mpumalanga on this one, they're very ready, combat ready, and it's available both on gas pipe as well as the oxygen itself, I'm sure prepared by Afrox. But other key issues that I want to raise, the Honorable Chair, is the issue of the staff across the provinces, not only within Mpumalanga. I think the issue of funding across these provinces, it's a very challenging issue, because when the mistakes happen, we tend to point at leadership of that province, and we know that the budget is not limitless and evenly spread across the province. I think if we were to argue with the Minister of Finance and also the Minister of Health, that the budget with the respective province should be proportionally be increased to deal with the aspect of the human resource, which has been the challenges across all the provinces. Thank you very much. And thank you, MEC, for wonderful work.
Okay. Thank you, honorable members, for your questions. On my side, it's a question that maybe I do not think it may be possible for MEC to answer, but nevertheless, if it does, we note that the vaccines arrived last night and they are already dispatched to provinces. I was going to check with Professor Glenda Gray, who's also part of the team, whether there was no need to quarantine. If not, then we will get to be appraised by science on that. My only question that I would like to check with you, Honorable MEC, is a simple one. I hope the HOD can confirm this is an operational matter. Do you have enough diesel in those hospitals that have got backup generators? We would hear stories that a hospital has procured a backup generator, yes, good enough, so that in the event there's ESCOM challenges, you then just switch on. But you hear a story that, we forgot to buy diesel. And that is obviously not the duty of an MEC, but HODs and the team that supports. Can I just get that, HOD? How do you make sure in your protocols you tick a box and say everybody has called me and indicated that there's enough of a diesel in that facility? The last one, I'm glad you are mentioning Rob Ferreira as one of the hospitals that you'll be using. I would imagine that the challenges that were there in Rob Ferreira about 3 years ago have since been sorted out. There were quite a lot of infrastructural challenges that Rob Ferreira faced over the past 3 years. Could you indicate that those challenges in Rob Ferreira Hospital have since been sorted out? Honorable, then MEC and your team, you can then start answering questions of the honorable members. Thanks.
Thank you very much, Chairperson. Let me allow the HOD to start, then I'll come after the HOD.
Thanks, Honorable MEC. I will start with some of the questions. Maybe I should also declare upfront that some of them I may not be able to respond to immediately. And I commit that we will be able to send some of the responses in writing as well. In terms of the clarity and the comparison between the home deaths and the COVID-related deaths, yes, it is true. This is also linked to the question about the number of deaths that we are seeing in Kharsibande. As I mentioned, we have there was about 104 deaths that we recorded at home. And this was being a challenge. And we noticed that in Kharsibande, in terms of our analysis, that many of them were not reporting to the institutions in terms of being sick. So when we do, as per the protocol, when they reported to the department, we do send the team to go and do the swab, and we then declare them as COVID-related deaths if they come back positive. So we did notice that in Kharsibande, we were having the challenge of patients coming late. Also, when the first wave had come, There was in Khasibande, it was very cold, and the areas that were extremely cold is where we noticed most of the deaths as well. In terms of Emalasheni, yes, the number of deaths were also high there. But remember, when we had the first wave as well, Emalasheni was our major hotspot, especially when the mines opened. And hence we see that when there's increased cases, even the death rates will also go higher there in that regard. In terms of the waste disposal, we have a company that is doing our waste disposal in the province, and we have made arrangements with them for them to be able to bring the separate boxes for the vaccine removal. They will be there with us during the period of the vaccine administration, and then they will remove it immediately. So it will not be stored in our facilities. In terms of the white 33 hospitals are not the white 31 hospitals are not 33 hospitals that we have. As I mentioned, Waterfall Boven is a very small hospital, and they don't have sufficient storage place for the vaccine or proper storage vaccine facilities. And then we have the other hospital, which is Sifuba, and a very tiny hospital that is now even incorporated into Amalo Hospital. So they won't be doing the vaccination separately; they will fall under Amalo Hospital as well. In terms of the corruption in the vaccine tenders, the vaccines are not being procured by the province. We are receiving the vaccines from the National Department, and all the procurement processes are being done by the National Department. So the province itself, we are not procuring any vaccines on our own. In terms of the mines that are surrounding the province, we have to say that we have been getting much assistance by the mines. Yes, I've only mentioned South 32 because of the ICU that I had mentioned where they assisted us, but the other mines are also assisting us. We have received great donations in terms of PPEs. They've also been assisting us when we're doing the contact tracing, and they have also been building clinics in our, especially in the Nkangala district. Even Sasol has assisted us with isolation and quarantine facilities as well. This is also linked to the question that was asked about the donations. The department did receive lots of donations from the mines and from other private sector as well. And we do declare these donations to the to the provincial treasury on a monthly basis as per our reporting. In terms of the private hospitals being part of the first phase and will they roll out separately? The response that we've also got from the national department is that the private sector were not comfortable to come to the public sector to receive their vaccinations, and they will be part of the second part of the first phase. That's in the next 80,000 that we will be receiving, the national department will receive, then it will be allocated to the private sector. At the moment, the way the teams are working is that there's a work stream at the national department that is dealing with the private sector, and we are now starting to have meetings with them as well as the province, so that we can be able to be updated in terms of the private sectors in our provinces as well. In terms of the shortage of transport, we did procure ambulances in 2019 as well as in 2020. It was 37 and 67, as well as EMS, as well as the planned patient transport vehicles. I think there were 66 of them, so that this can be able to assist us for ambulances. But in terms of the COVID, we have allocated ambulances per district specifically for COVID-related cases. During the peak of the first phase, we did have a challenge in Nkangala, and then we had to allocate 2 ambulances. So we also allocate if there's a necessity in terms of the number of cases that they're experiencing. In terms of the number that we received from the Cuban Brigade, we received 13 in the Cuban Brigade. 10 of them were family physicians that have been allocated to our institutions, and there were two biostatisticians and 1 epidemiologist that is assisting the teams in the provincial office with the COVID pandemic. In terms of the community health workers in the province, yes, we did. We took them, included them into the PERSAL system on the 1st of April 2020. There were some challenges that we experienced, but we have now managed to iron them out, because some of them had challenges with banking details, with duplicate IDs, etc., that we managed to be able to pay all of them. Currently, there was about 6,119 community health workers that we had taken over from the NGOs that we were funding. They are put on the PERSAL system, as I mentioned, and they're being paid the minimum wage. At the moment, we are paying them 3,633 stipend that they're receiving from PERSAL on a monthly basis. In terms of the new timelines that was asked about by the Honorable Van Staden, in terms of the new timelines and when we'll be able to complete, I think this is going to be very dependent on how we receive the vaccines from the national department in terms of the allocation. In the first round, as I mentioned earlier, we are receiving 2,000 doses for Rofrera, 840 for Woodbank Hospital to cover the number of staff that are there on the parcel. So in the next round, when the next 80,000 is expected, I think in another 2 weeks, we will see where we will be allocated and also which hospitals will be identified for the next round as well. So we will then be able to tell you when we can be able to complete all our healthcare workers, the 30,131 that was mentioned. Yes, we do agree that there was a challenge with the vehicles. We were also having problems in terms of the subsidized vehicles with the national tender, but I think that is also getting sorted out because we are starting to see that some of our staff are receiving the subsidized vehicles that was applied for. What we have done, as I mentioned, is that we did talk to other departments as well to be able to assist us, because in terms of the community screening and the contact tracing, it was also new activities that were part of the daily processes of the districts, and hence there was not sufficient vehicles at that time. Also, in terms of last year or this current financial year, we did prioritize the EMS over fleet vehicles, and we hope that in the next financial year, with our budget permitting, we'll be able to also replace and procure new fleet vehicles for the department. In terms of the screening at roadblocks, yes, I agree that maybe at the beginning there was some complaints that we also noticed on our social media for the social distancing, but we are ensuring that we are maintaining social distancing, and it is of course the responsibility of our staff and whoever else is there at the screening to ensure that we are maintaining the social distance that is there. So if there's any complaints, again, we can be able to address them individually, but we know that we have been training all our staff to ensure that the social distance is and the mask wearing is emphasized. In terms of the field hospitals and quarantine, as a department, we did not build separate field hospitals. What we did do is that we identified hospitals that we were not fully utilizing. For example, we looked at our TB hospitals. Our TB hospitals were not being fully utilized with the decentralization of the TB management as well. So we then upgraded these TB hospitals to serve as so-called field hospitals. We used Barberton TB hospitals. I think there's about 90 beds there. We used Standerton TB as well, where we renovated it and we were able to use it. And none of them at the moment have been filled with COVID positive patients. Mpumalanga Hospital in Woodbank is also, or in Malasheni is also one of the hospitals that has not been fully utilized. And we are also busy with those renovations so that they could be used for COVID patients as well. We had a new I ward that we were going to be built, that we had built in Tonga Hospital, and before it could be used as I ward, we also made sure that we had separated it and used it as well for COVID as needed. So in terms of the field hospitals, there's no field hospitals that we need to decommission because we didn't build anything that is new, and we used what we had. So these facilities, once the COVID pandemic is also over, will then be used for our normal day-to-day activities. In terms of the quarantine sites as well, we used our sites like MRTT and by the Mpumalanga Tourism and Parks Agency. We use their facilities as well so that we can be able to save in terms of outsourcing. Department of Public Works has also identified the private institutions where we were able to use if we needed for quarantine. In terms of the isolation, currently we have 5 sites and there are only about 40 patients that are in our isolation sites. So we can see that the numbers are decreasing, and if there's a need, we will then be able to discuss with Public Works so that we can get more isolation sites if it's needed in terms of the private sector as well. In terms of the new interns, yes, we have employed the new interns as they've been allocated by the national department. And all our posts that have been accredited by the Health Professions Council of South Africa have been filled with the new interns. And we have had no challenges in terms of the payment of the new interns. There were some delays in terms of the overtime payment at the end of January, but all of them were paid their overtime at the beginning of February. So we didn't have any challenges with the payment of the interns. In terms of PPE in the province, we are monitoring the PPE on a daily basis, as I mentioned. Currently, we are sitting at 93% in terms of the PPE, and I also gave the breakdown of the different categories of PPE and where we are. One of the honorable members also asked in terms of the relationship that we have with the organized labor. And our honorable MEC meets with them diligently every 2 weeks, where she gives them an update in terms of the PPE, in terms of the occupational health and safety committees, and also in terms of the statistics, she updates them. So they are also monitoring the PPEs at the facilities, and if there are any challenges that arise, they then bring it to the attention of the honorable MEC or myself immediately so that we can be able to address them. But in terms of the relationship, I think once the MEC has established this committee where we are meeting every 2 weeks, we must indicate that the relationship has been very good and we have never had any challenges or complaints about the lack of PPEs. There were some instances when we had challenges with the quality, but those quality, that was then withdrawn and we had them replaced. In terms of the lab tests that were asked, I think currently we have a backlog as of yesterday of about 671 specimens. In terms of the 1 day, it is 476 that we have the backlog for 1 day. For 2 days, it's 97, and for 5 days, it's 15. This is by the National Health Laboratory Services, and we have to say that it has improved. It was quite bad, but subsequently, the turnaround time has improved. In terms of the PPE corruption, and how many PPE corruption was there, you'll see from the SIU report that there was an issue that was mentioned about 2 officials that needed to be taken disciplinary action. When we had discussions with the Chief Investigating Officer, she did indicate that there were other reports that were coming and that we should just hang on with the disciplinary action because it may be the same officials that will be implicated so that we can then be able to take disciplinary action together rather than individually. So we're waiting for those reports, which they promised would be coming in the near future as well. In terms of the tender vaccine corruption that was asked, I think I've also already responded to that to say that we are not procuring vaccinations. This is being procured by the national department, so there's been no tender that has been advertised or any vaccines procured by the province itself. In terms of the number of vaccines for the private hospitals and having their own plan, I think as mentioned in the first part where we've got the 80,000, the private sector is not going to be involved. They may be involved in the next part, which will be the next 80,000 that will be received in the next 2 weeks. In terms of the detailed report that is required for the EMS services, I think we can be able to send the link as to how we distribute the ambulances and the number of stations that we have and how many ambulances we have per station. There was also a request for us to provide a detailed report on our quarantine sites and where all the interns have been placed. So we can be able to do that as well. In terms of the community service doctors that have finished where we have appointed them, we have only appointed those that are our bursary holders. And the reason being, as mentioned by one of the honorable members already, is that the funding challenges that we have as a department and as a sector are there. So we are unable to appoint all the community services or absorb all the community services. So we are making sure that where we have also invested in terms of bursaries, we then appoint those community health services, service official doctors that will be able to assist the province. I think the other question was in terms of how many are expected for the vaccine to be insured and uninsured. I will have to be able to send that because I don't know those figures off at the moment. In terms of whether the death in the public sector is more because of the shortage of PPEs, as I mentioned, I can assure the members that we don't have a shortage of PPEs in the province in terms of the public sector, and there's been no complaints that have been received either from organized labor in regards to that. In terms of the mortuaries and how they have coped, we have not had any major issues in terms of the mortuaries. We are having a good relationship with the COCTA and the local municipalities, and when challenges do arise, then we are able to address them together collectively. But for now, we have had no major issues in terms of the mortuaries and how they're being able to manage with the load. How are we ensuring that we also get information to our rural areas? We do have regular community radio slots that we are procuring, and that we provide this information as well through the local radio stations. so that the people in the rural areas are then able to understand it also in their languages. We also have this clinic-based model that our Honorable MEC has mentioned, and then the local councillors as well assist us there to be able to disseminate the information that is needed. In terms of the isolation facilities, I've mentioned already that they are decreasing because the need for the isolations have now also decreased. In terms of the oxygen supply and there being no shortage in the province, we have not had a real challenge with oxygen in the province. All our tanks, they have a trigger where when the oxygen reaches 50%, this trigger is also linked to AFROX, and they come and they refill our oxygen cylinders, and we place our orders on a weekly basis. So to date, we have had no challenges with the oxygen supply in the province. In terms of HR, yes, there are major shortages, but unfortunately, the budget that we have currently does not allow for us to appoint more staff. In fact, in this financial year, during the second adjustment, we took a budget cut of 534 million on COE alone, which made it impossible for us to be able to appoint further staff. If you look at the allocation for the next financial year, from National Treasury, our department in the province has taken a budget cut of 1.2 billion for COE only. So if you look at that amount of money, it's impossible for us to be making further appointments at the current level. So yes, Honorable Chairperson, any assistance in trying to make sure that there's no budget cuts for help will be welcome so that we can be able to appoint as per our plan. In terms of the number of vaccines that the MEC indicated that we are getting today versus the number of healthcare workers that are present, in terms of the vaccines, I mentioned we'll be getting 2,000 for Raw Ferreira, which is sufficient to be to vaccinate all the employees if they consent to the vaccination, because we have, I think, 1,738, if I'm not mistaken, on personnel in Raw Ferreira, and it's the same for Woodbank. The 1,640 that we are getting for Woodbank is also sufficient for all the staff that are in Woodbank. In terms of Woodbank Hospital being portrayed as very dirty, yes, our Honorable MEC, we did send a team there and they investigated, and we went to the root cause of the problem, and we managed to appoint staff that are in that facility, and we made sure that the challenge we also had was water, where the water was unable to come to the hospital. It was more a municipal problem of the whole Malashleni, where there are challenges with water as well. So as a department, we have also put up more tankers and more tanks in the institution, and we have had no further challenges in terms of the water shortages as well. In terms of how many healthcare workers have registered on the EVDS successfully, unfortunately, I don't have the full number here, but we have spoken to the National Department as well so that we can be able to get these statistics on a regular basis. But we have been popularizing it with our staff through all our communication as well to make sure that all of them are registering. We're also encouraging all of them to register. We've asked the management in the hospitals to also assist those staff that may not have access to a computer to be able to assist them to register as well. In terms of rain, it is true that many of our facilities have been affected by the rain. There have been leakages in many of our hospitals as well as our PHC facilities, as well as flooding. The rains have been extremely excessive in the last 2 or 3 weeks due to the Cyclone Eloise. In terms of our vaccine delivery, especially in the first phase, it's not going to be affected, but we are busy with the maintenance and fixing of all these leaks that have been identified during the storm damage. As a department, we are not going to be doing any trials to test the efficacy of the vaccine. This is why MRC is involved, because they are the ones that are have been registered for the trials and will be administering the vaccine and taking records. In terms of the traditional leaders and how they incorporate into the vaccine rollout plan, we had planned to start engaging with the traditional leaders, but we were also asked by National to just hang on because they were engaging with them on from a national level through the different forums, and we as the provincial leadership, provincial department are also then engaging there so that we can be able to see who will agree to be part of the plan, and they will be regarded under the essential workers when we are rolling out the plan. The allegation of some hospitals where healthcare workers that tested positive were given 22,000. Unfortunately, we're not aware of this. There's been no compensation by the department of 22,000 to any official. So if there are any specifics, it can be given to us and we can be able to investigate these allegations, because this is not true for the department. The support that we provide to the healthcare workers, we do have them engaged into the EAP. We also have counseling that we are providing to them as and when needed, and they've also formed their own support groups at some of our institutions that is also assisting them to be able to handle the stress that they are working under. In stakeholder relationship, I've already mentioned that we have a good relationship with the organized labor, where our Honorable MEC is meeting with them every 2 weeks and giving them information as well. The distribution of the EMS, as requested by the Honorable Chirwa, we will provide the details in terms of where exactly they are distributed and how many per station. In terms of the vaccination sites and if they are ready, yes, as indicated, we have 31 hospitals that have been identified, and we have identified where we will be doing the vaccinations, the number of vaccinators per site as well. Yes, we do agree that once we start, there may be hiccups that we'll be experiencing and that we'll be able to address it from time to time, because this is the first time we're going to be doing something of this scale. In terms of the vaccination sites, we can also provide, because as mentioned, all our hospitals were the first phase that we were getting ready. In terms of security, it cannot be left to MRC. As we mentioned, it is not that we have contracted MRC to do the security or to take over the security from the department. This is what was agreed upon at that level, because MRC is conducting the trial. MRC will be responsible for the vaccines in the sense that they will be giving it to the province because it has not been registered. So the MRC has been the one that have done the application and was successful to ensure that this vaccine is then given to the healthcare workers. So hence MRC will be taking that responsibility, not that we are shying away from our responsibility as a province. So you'll see that even during the administration of the vaccine, it is not going to even be the department officials that will be drawing the vaccine. It will be the MRC investigator themselves who will be drawing the vaccine because of the regulations that are there. And our vaccinators will then just inject the vaccine. So in terms of that, it's not that we are shying away from our security. But just to mention that, yes, we do agree that there was challenges with security in our institutions. Our Honorable Premier has also made sure that she had given us the funding to start the security measures in our institutions, and we have provided now, or we have appointed service providers for our 3 districts that will be assisting us to start, especially with the hotspot areas, so that we can be able to put our CCTV cameras, etc., in these areas. But I must say that our Honorable Premier had also given us money where we have put turnstiles, etc., in all our institutions as well. The access to the wheelchair, when I can't remember exactly which district it is as well, but all the issues that were raised by the community, we did take their names and we have given them, or we have addressed the issues. But if there's anybody that has not received a wheelchair, or if there's any issues that anyone has brought up, please, you can bring it back to us as well, and we can be able to follow up if there's the need. In terms of the long drop system, I think it was also a question. At the moment, in terms of the schools, I know that the Department of Education is addressing it to make sure that they do away with the long drop system. In terms of food parcels, unfortunately, Honorable MEC and Honorable Chair, I can't respond to that because that was done under the Department of Social Development. So in terms of the corruption that was there, I can't respond to that. In terms of the question asked by the Honorable Chairperson, in terms of diesel, whether we have enough diesel, yes, we do have enough diesel currently. What we also do is that we are monitoring the diesel in our facilities on a weekly basis, so that we ensure, especially with the load shedding that is there, that our diesel is enough in our facilities. And also we make sure that we do our testing of our generators on a weekly basis as well, to ensure that there are no challenges. So currently at the moment, we have no challenges with diesel, and our infrastructure directorate is also very active to ensure that they are keeping an eye on this. In terms of Rock Parade and the challenges, many of the challenges have been resolved. It is still under construction in some of the areas, and where we had challenges, We also have escalated to public works. For example, we did have challenge even with the laundry that was being constructed, and the contractor was eventually terminated and a new contractor appointed. So many of the infrastructure challenges have been resolved, but it is still under reservation, so not all have been resolved for now. Thank you, Honorable Chair and Honorable MEC.
Thank you, HOD, for responding to the questions raised. And maybe let me start by appreciating the comments made by honorable members, Chairperson, and the members of the Portfolio Committee, and indicate, as I've stated, that we really appreciate your comment because it will make us to improve and provide the quality health services that is expected from our people. Maybe to respond to some of the issues also, even though the HOD have responded, but on the issue of organized labor, let me also indicate that as an MEC, I personally bi-weekly have those meetings, and I make sure that I update organized labor on everything that we're doing as a department as far as COVID-19 is concerned, to an extent where now in our meetings, it takes even less than an hour because the challenges that we had when it started are every day being resolved. The issue of PPE is not a problem in the province because we are giving them the daily update of all the facilities in the province. And also we have a direct communication with organized labor. If they see that there's a problem, they are able to consult us. So where we are, we don't have a challenge. Even as far as the vaccine rollout, in fact, what I have, the strategy that I use of working with organized labor is that even before I go and present to ESCO, I consult with organized labor. I present to them, I take their input so that when I take the presentation to ESCO, the organized labor already they've inputted. So I've started doing that when it started dealing with COVID in the province. Hence, I can say that as far as working with organized labor, representing the workers, we are working very well, and that assists us in managing the COVID-19 in the province. And maybe also indicate as far as community health care workers are concerned, that when we started with community health care workers, they were on a contract, we had a contract with NPOs, then waited for the contract to end, and then we now put every community health care worker on PESA. And we, as agreed on the National Health Council Chairperson, we were paying them the 3.5. And the issue of absorbing the community health care workers, we are discussing that at an NHC level because because the challenges of the budgetary constraint, it becomes difficult. Hence the matter, we are discussing it at the NSC so that we agree on how are we going to move forward, because we understand that the work that the community health workers are doing, it is assisting us as a department, especially during COVID-19. We need to thank them for the good work that they've done. Hence, we have prioritized even their safety as far as PPE are concerned. And also, from time to time, we really appreciate that they're doing a good job for the department, not only in the province, but also in the country. The issue of security, I think the HOD have indicated we want to thank the Honorable Premier because the Honorable Premier came into the space and assisted a lot in terms of making sure that firstly, our workers are safe and also the patient, because you can't go to work every day knowing that you're not safe. Hence, we even changed the system that we were using before, where you find that people were parking inside the hospital. Now we have changed to say, because that's where people can go into the hospital, inside the hospital with maybe firearms and all that can harm the patients and also the workers. So there's a lot of changes that we've made in making sure that workers and patients are safe. And as HOD have indicated, what is it that we have done as far as the safety of our patients and workers are in the hospital and facilities. The issue of those that have registered in the EVDS system, the report that I'm getting is that so far, but it's not for the province, but of the countries, around 400,562, of which out of that, 161,926 are healthcare workers. So, but I'm still to receive a breakdown of the province from the minister. As far as traditional healers are concerned, we are, when I arrived in the Department of Health, there were no structures. What I did to show that they are important we launched the structures starting from the municipality to the district and to the provincials I'm speaking. We have those structures that I personally communicate with them. When we were at level 5, we had a meeting where they were complaining about your permits and all that. We assisted them, and we were also having a training so that they also prevent themselves from being infected with COVID-19. So I can safely say that we are consulting, we are working with them, the traditional healers in the province, and that has also assisted us a lot as far as making sure that they are considered. And also we are discussing to say, as far as the vaccine is concerned, at what stage are they going to get the vaccine? But of course, they would be prioritized to be vaccinated also in the country and in the province. I agree with you, Honorable Chira. The issue of EMS was a problem in the province, and since I arrived in the department with buying ambulances, and also on top of that, the planned patient transport that we've introduced, can say that even myself, because I make my number to be available to the community. So the community used to call me every day, every night. But these days, I can say that the calls have reduced, and it's because of the effort that we have put, because wherever you were going, people were complaining about EMS. But it was not only because of the EMS, but also in terms of the response time from the call centers, of which is something that we have improved as a province. And also because the very same ambulances that we're using to transport patients from one facility to another were the same EMS ambulance that was supposed to respond to emergency. Hence, now we've got the planned patient transport that will then alleviate the ambulances to focus on emergencies. Hence, I'm saying we might not be where we want to be, but at least the complaint and the response time now has improved based on the intervention that we have put in place. As far as communication is concerned, Chair, I can say that I'm leading the communication in the province, and also the communication that I'm leading is not only at the provincial level, it goes down to the local radio station, because I believe that that's where we must communicate the most. Hence, I always go to the local radio station where we connect all of the local radio stations, we give them updates, we look at the concern of the community at that time. I go there personally and I communicate. And over and above that, chairperson and members of the portfolio committee, the community health care the community health care workers, as they do their door-to-door screening, over and above, they are creating awareness, educating our people as far as health protocol is concerned, and that is assisting us, because you know that during the different levels where we could not even move, even now you can't coordinate big meetings. That's where we are focusing the door-to-door of the community health care workers. And also the reason why, when the Premier launched the ward-based model, is that when you have got key stakeholders, the communication at that level is easy to reach the people. And hence we further, as a department, launched the clinic-based model where the different stakeholders at the level of a clinic, they are there, and hence it's also a platform that we are using, because you've got your traditional healers, you've got your traditional leaders, you've got your religious leaders, they are business people. So all these structures that we have formed assist us as a province to be able to communicate any information that we want to communicate to our people during this difficult time of COVID-19. But the chairperson, maybe the issue of that was personal asked to me, Honorable Chira, about the wheelchair, I might not be in a position to specifically respond to your question, because as an MEC, I receive a lot of requests, and what I always get in terms of response is that most of the people that send requests to me, they are responded to, but I can't specifically respond to the one that you're referring to, because you remember that we had so many public hearing, and also not only the public hearing, but there are so many requests that I get. But I know that most of the requests that we get, the department, the official, the HOD does respond, but I cannot specifically now, but I can go back and check, but I cannot now specifically say on that one we have responded or not. But Chair, thank you very much for your input. And as I've said, we are taking those inputs serious. And also the issue of security, as the HOD has indicated, we are prioritizing security as a province, and we will continue to make sure that we do that. So thank you very much, Chairperson and members of the Portfolio Committee.
Okay. For honorable members, there are those of you might not have seen the platform that since we still have time on our side, and if you want to raise questions, the following 3 members have indicated that they'll like to further engage with the department. So, Honorable MEC, we are not done yet. Stay put. The following 3 members have indicated that they would like to have follow-up questions in this order. Honorable Ismail, Honorable Dr. Tembekwayo, and Honorable Munyai. In that order, please.
Thank you, Chair, and thank you for the responses from the department. Firstly, I just wanted to, maybe in a point of clarity or just for better understanding, the HUDA stated that, only community service doctors that have been, that had bursaries with them, bursary holders were actually absorbed into the system. But considering that, there's a shortage of healthcare workers, will the department then maybe consider absorbing these community service doctors? Because I know right now they are actually sitting in a predicament because they haven't got jobs. And at the time of this pandemic, I mean, we should really use every hand that is possible. That's one. Secondly, the contact details will be highly appreciated. Thirdly, I just want an understanding. I see on one of the slides, let me just sign my phone. On one of the slides, it shows the case distribution per age group. I've noted that, 6,641 confirmed cases, that is at least around 10% under 19 years that have actually, been hospitalized. Just for a matter of, understanding it better or maybe clarity, I mean, these children or under 19 that cases that we're looking at, is it in a particular area of the province? Is there, I mean, anything that we can look into it to say, what, why so many? It may be 10%, maybe little compared to the balance that we're looking at, but still to these are children. And I just want you to know if the department has seen any significant rise in any particular area or any particular reason. Thank you.
Thank you, Chairperson. I just want to, I put the message on the chat to ask for any contact details that we can use, because I had the MEC talking about people calling her. Can we have that number? And then if it also has a WhatsApp access. So we need a number for the HOD, the working one, not the numbers that we can call that where we don't get any response whatsoever of the HOD and the MEC. And the second question, I just want to ask whether in your province you have the internships of orthotics and prosthetics, and are you paying them a stipend? If you are paying them a stipend, how much is it? Thank you. Thank you, Chair.
Thank you, Honorable Munyai.
Thank you very much, Honorable Chair. Since the SAMRC is responsible for vaccine there in Mpumalanga, I think I want to propose, Chair, that maybe at some point to get much more details, we may have to request the SAMRC president to come and be with the portfolio. I'm not saying it should be immediate. It will be accordance to your own program, Honorable Chair. Thank you.
Okay. Some of the numbers that at least Honorable Dr. Tembekwayo, one of the numbers that you have requested, I've sent to you, and then the HOD will respond with her number. But the one for the MEC, all members have got it. I've given you more than what you need. I've given you almost about 5 MEC's numbers that are there, so you can have a field of that. HOD is not you and you alone. Generally speaking, when Treasury cuts off our budget in health, the thing that suffers most is HR, employment of new staff. I hear you mentioning that. Did you do that only in HR, or did you proportionally maybe cut here and there, cut a new equipment for this hospital, cut maybe the roofing of this clinic, cut one ambulance, or you just focused on cutting on the HR staff only? Because that is what I heard you mentioning, that because the budget was cut, which is something that always happens with health, they cut the budget, and therefore the provinces will normally just stop employing more people and cut that one. Did you proportionally cut from other areas or not? Thanks. HOD, MEC, but mainly it was HOD as to be answering those questions. You can start.
Okay, thank you, Honorable Chairperson, for the further questions. In terms of the community service, whether we'll consider appointing or absorbing others, the challenge we have, as I mentioned, is the budget. If we had enough budget, we'd be able to appoint all of them. What we are doing is that where there was, we may have a medical officer grade 1 that is available, then we advertise the post, and all the community service then will have to compete, because it will not be fair to absorb one in that particular hospital and not give the others an opportunity. But unfortunately, because of the budget challenges, we are unable to appoint all the ComServe doctors, despite the fact, as you mentioned, that there is still a shortage and there's a need for more. The contact details, Honorable Chairperson, I put it on the chat group, but my cell number is 082 771 5697. 082 771 5697. And it is also a WhatsApp number. On the chat group, I've also sent my email address in case there's any complaints that you want to be able to forward to us. In terms of the case distribution per age group, the 10% is not necessarily all those that were hospitalized, but it's all those that were under 19 that tested positive for COVID. We did notice that there was an increase. You'll find that every day we are also monitoring the number of COVID cases in those that are under 19. Unfortunately, for now, I don't have the information as to whether it was located in a specific area or not. So I'm unable to answer that for now. But it is, like I mentioned, it's not hospitalized, but those that tested positive. We'll try and see the details of the people that were calling so that we can be able to give. I think my MEC's details, you've already sent it to the honorable members. In terms of the internship for prosthetic and for the mock cases, mock professionals, yes, we are taking internship. I think we have 4 at the moment. Unfortunately, I don't know the stipend that we are paying them offhand. I'm not sure if any of my managers know how much we are paying them exactly, but I know we are paying them a stipend as well. In terms of the budget cuts, Honorable Chair, the letter that we've got from the Provincial Treasury indicating our budget for the next financial year indicates that the budget cut was done on COE. So we were not requested to cut the budget further. It was a letter that we have received already from Treasury in terms of the allocation for next year, which shows that there's a budget cut of 1.2 billion on COE alone. Thanks, Honorable Chair.
Honorable members, any other matter? I'm sure you have exhausted your wish to ask. May I just read to you the areas where you could actually be visiting if you have time between now and before the sitting today. I have received information that in the Eastern Cape, Nelson Mandela Academic Hospital and Leviston Hospital in PE, Nelson Mandela being in Umtata, will be receiving vaccines this afternoon. In the Free State, Pelanomi Hospital and Universitas Hospital. In Gauteng, it's Chris Hani Baragwanath and Steve Biko Hospital. KwaZulu-Natal will be Nkosi Albert Luthuli and Prince Mshini Hospitals. In the Limpopo is Polokwane and Mankweng Hospitals. In Mpumalanga is Rob Ferreira and Witbank Hospitals, as I've heard. Northern Cape is Robert Mangaliso Hospital and Kimberley Hospitals. In Northwest is Job Shimankana Tabane Hospital in Rustenburg and Tepong Hospital in Klerksdorp. Western Cape will be Kalisha Hospital and Tygerberg Hospital, and they have 3 and Grooteskill Hospitals. If members have time between now and before 2 o'clock and they would want to visit there, you might be welcomed very much, just to also not do our own oversight and make sure and maybe ask questions that you'd like to ask in that space. Honorable members, any other matter, any other member would like to raise?
Thank you very much, Chair. It's Honorable Anna. Let me thank you for the information that you have just shared with us now. We really appreciate Chairperson. Hoping that members will be able to attend. Chairperson, I just want to support the matter as tabled by you as a chair of the portfolio and moved by Honorable Munyai of us having a meeting on Friday to approve the minutes. I fully support that, Chair. Let's move. Thank you very much, Chair.
Honorable members, please forgive us. We really please, there will be a challenge on that if we do not get this matter attended administratively.
Sure.
Okay, with that, Ismail.
Thank you, Chair. I just want to put a request formally to you to please, if we.
I just wanted to find out, is it possible for us as a committee to discuss committee-related matters outside the invited? I mean, we have invited guests to come and speak to us. We can't discuss issues that are related to our committee strictly in the presence of the visitors, please, in the presence of the guests, please.
Okay, noted. Okay, let me then give our thanks to MC Sesekani Manzini, her team, for the presentation. This is not the end of our interaction with yourself. We'll continue to engage, and sometimes we'll come visiting your places and see. But as members have asked, we thank you for keeping the fort up there, challenges as they are, and assisting and working. Maybe we must take this opportunity as a very good opportunity to continue to cement your relationship with the private health sector. This COVID has really made us to be very close to each other, and don't lose that, and also don't lose your work relationship with the traditional healers and traditional leaders in our space. We then can thank you, and then you can be released, MC Manzini. Thanks.
Thank you, Chairperson.
Thank you, Chairperson and honorable members.
Okay, thank you. All right. Yes, no, Dr. Tembekwa, I know what you are saying. Maybe those are some of the things that one might just apologize for raising a matter when there are already other people who have joined us. We, in fact, you have actually raised something that I wanted to raise with you, having discussed with the secretary, because we seem not to be organized in that regard. That I wanted to make a request that in future, if we are going to have a 9 o'clock meeting, we do in-house meeting or issues. We can either invite the people to join us at 9:30, or we start at 8:30 with our in-house issues, and then at 9 o'clock, whoever is coming in will then log in. And so it may actually ask, I don't want us to say the people who are invited must come at 9:30, because we might even begin to compromise ourselves. Honorable Wilson is asking if there's no plenary on Friday. Ms. Machalamba, is there a plenary on Friday? Where's Ms. Machalamba? Yes.
No, Chair.
No, there's no plenary on Friday. Members, I'm requesting that in future we start our meetings at 8:30 to avoid the things that Honorable Dr. Tembekwa has raised, where we mix internal correspondence and announcements with the meeting of people who have already been invited. that at 9 o'clock we are then able to switch on into a meeting and get them to join us. I'm reluctant to request that we invite them to start at 9:30 because that might even compromise the presentations even further. But I was going to, if we're all together sitting in one house, it may be possible as it normally happens in Cape Town. But can we request, honorable members, that in case one has got a correspondence, those meetings might be asked to start at 8:30. That is what we were proposing with the discussion I've had with the secretary, so that we can avoid this confusion and being disorganized and getting members to discuss things that are overlapping to the presentations. Okay. If members then are having to consider that or they are happy, we'll then bring this meeting to a close, honorable members, and then we meet again through another virtual platform at 2. Thank you.
Thank you, Chair.
Thank you, Chair. Thank you, Chair.
Thank you, Chair.
Thank you, Chair.
Mahlengwa sawubona.
Yebo, bengihlushwa yi-network e-KZN.
Right, sithandwa sami.
Ngi-right.
Siyabonga ma.
Asibe right sibonane bakwethu.
Yebo.
Hey.